Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, I'm Heather Roythorne Finch. I'm 32. I was born in Leicester City and I live in rural Leicestershire and have done all my life. I studied agriculture at the University of Newcastle upon Tyne. I now work and have done all my life in the voluntary and community sector. As a youth, I was heavily involved in scouting and now volunteer with the Women's Institute.
Well, Heather, welcome to Cancer Stories, which is the name we call this video program. Thanks for coming in today.
Okay.
I know you've come in to tell us a bit about your diagnosis and also what's happened after the diagnosis, you know, how you've been since then. Maybe a sensible place to start is to tell viewers how the diagnosis was made at the beginning. Okay.
Initially, I presented at my GP surgery with a very deep cough, very sustained and persistent. It took a couple of trips to the doctor, but eventually had chest x-ray, and that showed a mass in my chest, in my mediastinum, about the size of a cricket ball, and that was diagnosed through biopsy as a non-Hodgkin's lymphoma. And as it transpired, I was also suffering from many of the traditional symptoms of that type of cancer: night sweats and weight loss and itching, but at the time didn't associate them with cancer. So that's how I was diagnosed.
How long do you think it was between the start of those symptoms and when the diagnosis was made?
It was about 3 months, yeah.
That was fairly prompt then.
Yes, at the time it felt quite drawn out, but when I look back on it and hear other stories, yes, you know, and once I'd been diagnosed, the process moved very rapidly.
So what was the next step for you once the scan had been done and they'd found that mass, as you said?
So I met with the haematology professors and we determined that chemotherapy was a positive course of action. So I was due to start chemotherapy, R-CHOP chemotherapy, just prior to 2010. And however, my illness, I deteriorated ahead of starting chemotherapy. So things would move forward, and I had my first cycle of chemotherapy earlier, sort of as an emergency inpatient.
What can you remember about that difficult time where you basically had the diagnosis but you were waiting for the treatment to start?
It was a very difficult time because my GP rang me with the diagnosis at work. She did ask me if I wanted to hear the diagnosis and I said yes. However, when she told me it was lymphoma, she obviously didn't know a family history, which is that my sister has also had lymphoma, and therefore I understood immediately what she meant. So the shock of that, and also understanding what was to come as well. And then there was a period of, as you say, a period of waiting for treatment, waiting for appointments, but still having to go to work and getting steadily more and more ill as well. It was very debilitating, and that was hard.
So you were actually trying to go to work through this?
Absolutely, yeah. Up until treatment started, yes, I was still working full time. Yeah.
How difficult was that in itself? Because I know a lot of people really do want to maintain their work, when they're diagnosed.
In many ways, it was a good thing because there was nothing I could be doing at home, and I'd got a good support network of colleagues and friends, and my employers were very supportive and kept me busy, which is what I wanted. And I found that a very positive experience. And also, they were very flexible about enabling me to access hospital as and when necessary.
Who were you working for at that time?
I was working for Voluntary Action Leicestershire, who I still work for now. Yeah.
And were they quite understanding as an employer?
They were very understanding, very supportive. They kept me involved. They kept me informed of changes at work, and with no pressure to get involved, but they kept me up to speed with what was going on, so that I always felt a part of the team. There was always a desk for me when we moved offices. I was always on plans and things, so I never felt like I'd gone away.
Do you have any advice for patients who are wondering whether they should still carry on working when they may be having some symptoms and they may be required to attend for treatment, but they're not sure whether they can still hold down the job?
I think if you feel able, both mentally and physically, to continue working, then it's really important. For me, it was certainly important because it gave me a focus, rather than spending all my time focusing on my possible illness and what was to come. Also, my employer were very supportive, and the legislation now means that employers have to think even more about the support that they give to cancer patients. And also, when I was undergoing radiotherapy, I did that during my working week, and went and received my radiotherapy and then came back to work. So it's more like going to a meeting than it was spending hours and hours in hospital and then going home. And so I found that to be very useful.
One of the difficult things when people are unwell is the whole day-to-day life can almost become consumed with appointments or medical issues or taking treatment or even just cancer worries in general.
Yeah.
Were you able to maintain a kind of balance between your normal life that you wanted to hold on to and those medical things?
I think for the most part I was. Certainly when I was first diagnosed, obviously the world fell apart for a short while, but then as you start to get into a system of appointments, as you say, you realise that you can't, or I couldn't, spend all my time being consumed by it because it was exhausting and upsetting, and those around you want to help and support you, but they don't know what to say and what to do, and they're emotional as well. So I found by working, it gave me other focuses, other things to talk about, other passions to get involved in, and definitely helped. Yeah.
How did you find your work colleagues responded?
They were shocked initially, but very, very supportive, and they really rallied round me. It was a difficult time at work anyway, as we restructured, and so that gave us additional focus, but they were very supportive of me, and so were management, and very enthusiastic about being there for me and for my friends and family.
Let me ask you whether you came across any other patients, either with a non-Hodgkin's lymphoma or maybe a related condition, whilst you were in the hospital system that proved valuable for you.
Certainly, I've made a lot of friends and acquaintances along the way. When you receive treatment on the day ward, it's everybody on the day ward on that day is having treatment for roughly the same type of condition. So you start to see familiar faces because everybody's going on the same day, and they're staggered in the same way. And you also get to know the nursing staff as well. And yes, that's certainly an opportunity to sort of share stories and sort of get tips and hints, and just to also check that what you're going through is what someone else is going through. But I did make particular friends when I was an inpatient with people who were awaiting transplants as well. As we've gone through transplant and come out the other side, we now see each other at our monthly and weekly appointments and check on progress. And we've all had differing levels of success in how we've recovered and at what stages because of the nature of our treatment. But it's always positive, to see the people each time you go and find out what they've been up to and how they're getting along, and also check in with their partners and their families as well. For my husband and my parents taking me to appointments or coming with me, they interact with the other relatives as well, and which is very helpful.
One thing that is sometimes available is support groups, either specific to the condition or more generalised. Do you think the hospital should take a role in organising those kind of things for people?
There is a support group for my cancer, which I did attend. It wasn't for me in the sense that the other members of the support group were under what's called watch and wait. So they weren't actually having any treatment or sort of invasive treatment. Not to say that they didn't have, problems associated, but so for me that wasn't particularly helpful. But there are some very good support groups out there. I don't think they necessarily need to be organised by the hospital, but certainly just promoted, which they are. The lymphoma nurses provided me with a huge amount of information, which you don't have to read it all immediately. You can put it to the side, and when you're ready, pick bits up and dip in and dip out of it. And that's what we've done as a family, and found it to be useful.
So let's catch up with what happened in terms of your treatment, I guess. So the diagnosis had been made. You said it was a non-Hodgkin's lymphoma, and you'd seen the medical staff and they were planning to start the treatment. What was the next step? So
the plan was to begin with R-CHOP chemotherapy in late December. My condition deteriorated so that the cancerous mass in my chest was restricting my ability to breathe and putting pressure on my heart. So they brought it forward by about a month, and I started out by having a fraction of radiotherapy, which had an almost instant effect. And then I began a course of 8 cycles of R-CHOP chemotherapy as an outpatient. So I would visit the day ward once every 3 weeks, spend about 6 to 8 hours on the day ward receiving chemotherapy drugs by intravenous drip, and then go home with various medications such as steroids to help you over feeling unwell, and a lot of anti-sickness medication. And whilst I felt unwell, and I did lose my hair during that period of time, I was still able to potter around the house, go out and about when I had the energy and felt well enough. But I was off work at that point. I didn't have the energy for work, but I was up and about every day, and over a 3-week cycle, you feel unwell, and then gradually you feel well again, and then you have your next dose of chemotherapy. So I went through that process.
Now, not everybody responds the same way to chemotherapy. I know there's a lot of individual variation, and of course chemotherapy can be oral tablets that you take at home sometimes, but it can usually at the beginning it's that intravenous therapy that you have to attend the chemotherapy suite to have. How did you manage that time? Because there's the issue of the effects of the drugs, but there's also attending the chemotherapy suite and actually staying there for quite a long period each day.
Yeah, I was very lucky. My husband was able to, his work were very supportive, and he was able to come with me each time. The second time I went for chemotherapy was particularly hard because I knew what was coming. I'd gone through one cycle, I knew it was going to make me ill, and I just started to feel better, and so that was quite upsetting. But the staff were really helpful. They gave me time to sort of rationalise things and understand that it was a process I needed to go through, and that I'd already started the process as well. The suite, although not huge, you know, it's as comfortable as it can be, and there's drinks and refreshments available, and the staff are all very friendly, and the other patients as well. It's a good opportunity to talk to other patients and to hear how they're getting on, and you pick up tips and hints, and talk to their families. I took a laptop in, books as well, and also just take the opportunity to have a sleep and a rest, so that when you're out of hospital for the rest of the week, you've got a bit more energy.
Mm. And what was that recovery period like after the chemotherapy came to an end?
So I was off work for 6 months. I finished chemotherapy and then had radiotherapy, 15 sessions of that. But as I say, I did that whilst I was working.
Mm. So how did you find the radiotherapy then compared to the chemotherapy?
The radiotherapy is pain-free. You lie on a table and you receive radiation, but it does take its toll on you as time goes on. You get a bit cocky in the middle. You think, oh, it's not had an effect, and then you start to feel sort of tired, and depending on where it's targeted, you can have a sore throat and things like that. But overall, I was okay with the radiotherapy. I didn't have too many effects, just some tiredness.
Mm-hmm.
Yeah.
After the chemotherapy and radiotherapy finishes, it typically takes months to feel kind of back to your normal self. And was that the case for you?
Yes, my energy levels were a bit low. Obviously my immunity was compromised, but I was back at work and I sort of kept going. But for me, although I was in partial remission, the feeling was I never regained confidence that I was getting well, and that's what brought me to return for further tests.
Mm. And I think you mentioned to me earlier there was a relapse, in fact. So that lack of confidence, was it because you were detecting symptoms that weren't resolving? Or?
Yes. So I actually presented back at haematology with pain in my groin, and I was very concerned that the cancer had actually spread from my chest area. They did X-ray and a CT scan, and actually, although it had returned, it was in my chest and it was growing in a small way. So it was still stage 1. Decisions had to be made about treatment options, and that was the period of time when both me and my husband were just devastated. I mean, that really, was it. We thought we'd gone through it all. We thought we were coming out the other side, and then there we were again, and we didn't know whether there were any options at that point. But I was very fortunate in that my medical team felt that because I was young and healthy, as a general rule, there were options. So we tried 2 other forms of intravenous chemotherapy first of all, which meant that I was an inpatient for a number of days whilst I received the chemotherapy, and that was particularly gruelling. It made you feel very unwell, and I lost my hair again, which had only just started to grow back, and yeah, that did make you feel very unwell. But then you would go home, and gradually over a period of a few weeks you'd feel a bit better, but it certainly did knock the wind out of my sails, definitely.
I can imagine that was a really difficult period, and a period of uncertainty as well, because you never regained really your former self before that deterioration came on again.
That's right, and sort of in my working life was just on a bit of a high and going very well, and my career development. So I was very positive about that, but I was always in the back of my mind was this fact that it's not gone. I'm not free of it, and so to have the re-diagnosis was almost like, yes, I was right, but I didn't actually want to be right, and it was just terrible. The thoughts and that period of time. And also, my husband and I had started to consider having a family and the options around that, and seen fertility specialists. And obviously, with knowing I'd got to go through chemotherapy again, those chances were certainly pushed to the boundaries. Options became irrelevant at that time.
I know people watching will be interested in that question of the advice regarding fertility, and also what happens when you have chemotherapy or radiotherapy or subsequently. What are the restrictions, but also what are the options later?
So for myself, because my diagnosis was what seemed like quite rapid, I didn't have the option to store my eggs, which is often made available to people. Women can go through that process, but for me, that wasn't an option because I needed to move quickly with treatment. So that's one option often available. I was advised and supported in the fact that chemotherapy has an impact on fertility. The different types of chemotherapy impact to varying degrees. I had a specialist lymphoma nurse who spent a lot of time with myself and my husband discussing this. We had to rationalise that if I didn't undergo any treatment, then any opportunity to have a family was lost anyway. So I underwent my first phases of treatment, and then whilst in remission we began to explore the possibilities of what my fertility levels were with the help of the hospital. And although I'd lost some fertility, I still had the ability to carry a child, but because I'd had chemotherapy I needed to wait 2 years for those drugs to have left my body so that a baby would be healthy. So we went into a period of waiting basically, and that is when the cancer returned, and I started further chemotherapy. So that was where we went.
After the return of the cancer, that was treated again with chemotherapy, and then was that successful in the end?
The chemotherapy the second time around was extremely emotional. They tested me very early with PET scans to see whether it was working. They were very keen to see whether it was working or not, and it didn't show that it was working. In fact, it showed that the cancer had grown, which left me in a very uncertain period of time as to whether there was any further treatment for me, really. So they left it a few more weeks and then re-scanned, and it showed that it was starting to work, which of course was a huge relief. And then it was a case of, well, we're not going to get rid of the cancer through chemotherapy alone. So we explored the option of a stem cell transplant. And I underwent a stem cell transplant from a donor on November the 4th of 2011.
Now, a lot of people won't necessarily know much about stem cell transplants. Can you say kind of an overview what they're all about?
So a stem cell transplant is stem cells are taken from a donor's blood in much the same way that they would donate blood anyway to a blood bank, and they are stored and then taken to the patient after they've been worked on by the laboratory. The patient, myself, I underwent, you become an inpatient, you have your own room, it's an isolation room, and you undergo a week's worth of different chemotherapy drugs. And after that, you receive your transplant, and it's very unglamorous, and it's simply a bag of cells like a blood transfusion, and it takes about half an hour. The actual having of the cells is painless. It has no immediate effects, but what it does is it strips your body, and the chemotherapy strips your body of any immune system. It kills off all of your sort of cells, good and bad. And then the new immune system gradually has to build itself back up again. So during sort of the first 4 or 5 weeks of that period, you are extremely ill, you are an inpatient, and then gradually you start to feel a little bit better. It is a very long and slow process. I was discharged after 5 weeks to go home and begin sort of rehabilitation at home.
Mm. Looking back on that period now, that's a lot to go through when you've already been through those previous steps. Do you think you were prepared for that treatment?
I don't think you can be prepared for it, and in some ways that's probably a good thing, because if you know what's ahead, then sometimes you don't want to fight it, whereas the unknown is something is probably better, because then you fight it with everything you've got. The nursing staff are tremendous on the bone marrow and transplant ward. They deal with exactly what you're going through every day. Nothing's new to them, and although you may feel undignified at times, and they are fully prepared for you. You can do things to prepare your room that you're going to be in. You can take some of your own bedding, and you can take pictures for your walls, and things like that, to make it sort of a little bit of a home from home. And when you're well, you can have visitors, although some of the time you just don't feel like it. So it's not a lonely time. Although when I first went in, when I felt well, and I was in for a few days before I started treatment, that was hard, because I couldn't understand how I was going to cope. But I received support through the psych oncology team, and talked things through. And once you start your treatment, you're in some ways you're busy, and in other ways you're poorly as well. So, that's how your time is spent.
Were there any other restrictions placed on you during that period of being on bone marrow transplant unit?
The restrictions that you have are based upon how well you feel, really. You are restricted to your room, although it is a large room, and it has an ensuite bathroom. But because of some of the symptoms that you will have, you might be infectious to other patients. There's only 5 patients on the ward. When you're well and not of an infectious nature, you can go and there's a small kitchen with refreshments, but the rest of the time you're in your room, and there's nurses coming and going all the time, and you can there's no restriction on visiting. Patients can have their friends and relatives with them all the time, although you will find that you only perhaps want your 1 or 2 closest to come. And also my husband stayed, they have a spare bed, as it were, and my husband spent a couple of weekends staying with me, and that really made a difference as well.
So let's talk about how families cope with this, and particularly your husband, or wider family, because they were seeing the ups and downs all through this, weren't they?
Yeah. My husband was devastated. We're a very strong unit, and we both bring different things to the relationship, and he took on the caring role amazingly well, and cared for me when I came home. He cooked, cleaned, he did all the tasks that I did, and his own, and continued to work full time. His employers were great, very caring, accessible, because he worked shifts. So he was doing his work, then coming straight to the hospital, sitting with me for sort of 8 hours, and then going home and go to bed and go to work again. It certainly was a testing time emotionally, and especially when we thought that together we were moving forwards in our lives, to have it put on hold again was terrible. Yeah.
Did you find that he coped in different ways to you, maybe?
I think he found it hard in the sense that he didn't always have someone to talk to about his feelings, or how he was feeling. We did talk about how we felt together. We didn't sort of bottle up too much. And we talked to family as well, and where we could, close friends. The time when I was going through inpatient chemotherapy, my father was also receiving radiotherapy for his own illness. So I felt very guilty at that stage, because that was supposed to be my time to support him. And I found that hard, because he had cancer, and that was almost put to the back of the family's mind. He just got on with it and had his treatment and had his symptoms, while everybody focused on my illness. And to me, that was not how that was supposed to be.
Why do you think that was, really?
I think mainly because he was not an inpatient. He was undergoing radiotherapy, and I was an inpatient for a week at a time having chemotherapy, and his, as with radiotherapy, his responses to that didn't present until quite far down his treatment line.
What cancer did he have?
He had prostate cancer, and it was found very early, and I think we all felt very positive about that. But it just felt, for me, I felt like I should have been able to offer the support to him, emotionally and in time, you know, like taking him to hospital appointments, things like that, which is practical things that if I was well, I would have done. But which he'd done for me, but because I was unwell, I couldn't offer that, and nor could my husband. You know, we were sort of busy being ill ourselves.
How did your dad get on?
Very successfully. He's fit and well, and you know, we're thankful for that.
Well, that's good. So, I mean, now skipping ahead, I know, but you know, you're kind of well and he's well. Do you have something in common there you can talk about?
Yes, we do, and we all, I mean, and as my sister has also had cancer as well, so we all understand, you know, the fact that you'll have your appointment, whether it be monthly or quarterly or annually, and you'll get very emotional and worked up ahead of it. You have it, and it's all being well, it's good news, and then you forget about it to a point, and you're busy living your life, and then suddenly you're like, right, I've got months to my appointment or a week to my appointment, and suddenly it's all back there again, and you know, and you start to worry again. So as a family, we fully understand how overcoming cancer and living with it and after it doesn't consume your life, but it's always a part of there. It's always there, you know. And if you get a cold or a cough, it's like, oh, well, is this, you know, and then you have to be rational, and you know, rather than just worry about it, you have to go and see a doctor and be proactive.
So in that recovery period then, after the stem cells were given, I assume, am I right, that you improved steadily after that?
Yes, I was an inpatient for 5 weeks, and that was when I was at my most poorly. But gradually I improved. I had some complications. Some damage was done to my heart by the chemotherapy, but they managed that. They monitored me. I was very well cared for. So when I came home, they don't give you a lot of warning that you're going to be sent home from the transplant ward, so that if it doesn't happen, you don't feel upset. So I was told on the Monday I was going home on the Tuesday, and there are obviously a lot of things that have to be done. The house had to be thoroughly cleaned. Because you have no immune system, there's a lot of things that, although you're very ill and wouldn't want to do, you certainly can't do, like cleaning, because of the dust. So, you know, but you're talked through all of that by the nursing staff, and given information, and to begin with, when you go home, you have 2 appointments a week with the team, and gradually, little by little, sort of week by week, my health improved. I was eating a bit more. I was gaining some weight and wasn't feeling as sick, and just gradually getting some strength, physical and mental strength to do a bit more, and feel inclined to read a book or, you know, do some craft work or something like that. As the appointments are stretched to month by month, that's when you really start to notice that you're able to do a lot more. And for the first 6 months after transplant, you're restricted to safe environments, so your home and a friend or family's home, not public places, not shopping, things like that. You can go out in the fresh air if you have the energy, you know, socialising and things like that. You don't feel well enough to start with, but just as it starts to feel like you're being restricted, the restriction is lifted, and you can carefully reintroduce yourself into social sort of activities.
That sounds like quite a delicate process in a way, because there's no firm boundaries, are there, really?
No. You know, I mean, you could come home from hospital and go straight out if you wanted. You wouldn't feel well enough, and you've probably not got the confidence to do that, and you would be foolish. I suppose for me, I was extremely lucky. I never questioned that I would get a donor. In my head, I never went to that place where, what if I don't get a donor? and I did get a donor and I got a good match, but somebody gave their time to give me cells that were going to hopefully save and prolong my life. So it was important that I did everything that I could do, and if all I could do was stay inside and stay at home, then that's what I did. I had visitors, I had friends round, but if they or their children had got a cold, they didn't come. And I didn't feel sad because they didn't come. I knew that they weren't coming to visit me because they wanted to help. It is a long, slow process, but there are no sort of gates, as it were, but a lot of it's energy driven, and it's also driven by the fact that if you do anything that's detrimental to what you've had, then there's only so much that the team can do to make a transplant work.
Looking at the whole process now, the whole journey from that beginning to the diagnosis, the treatment and the recovery, did you pick up anything along the line that you thought, well, I wouldn't have known that unless I'd been through it, and that was actually useful to know? Things that patients watching this would find potentially valuable?
I think there's some little things. A lot of people worry about losing their hair. For me, it was very hard that, yes, I lost my hair, but it was a symptom of my treatment rather than a symptom of my illness, and it was something that would grow back. There are amazing wigs available, and they are free on the NHS. So for women and for men, there is a lot of support available around that. And there are benefits to it, because when you're ill, you don't want to shave your legs, so you don't have to worry about that. Something that doesn't necessarily come out naturally is the need for financial support. Your nurse will talk to you about financial support, but also, even if you think you're not eligible for benefits, they are out there and they are available for people, because cancer is classed as a disability, and you may not feel like you're disabled at some times, but there'll be other times when you certainly do, and those services and financial supports are available. Definitely, when you're well, it's worth investigating those things, and that's something that could keep you busy once you've been diagnosed as well, getting that kind of paperwork prepared and sorted out.
Now, regarding the hair and also body image in general, for example, if your weight changes or you're not comfortable entirely with your appearance, many people find it difficult to carry on as normal whilst their appearance has changed. Sometimes people are reticent to have a visitor who they haven't seen because they think, I don't want people to see me unwell.
I suppose what I would say is, your friends see you as they've always seen you. They see you as unwell, but they know what you normally look like. They know what your normal demeanour is, and you've still got your same mannerisms, your same sense of humour. It's all still there. You're still you. You just, might be wearing your jogging bottoms instead of your work suit, or, be in your pyjamas instead of your overalls. It doesn't matter. They come to see you and spend time with you. And if you're having a good day, and you're a woman, put some makeup on if you feel you can. It really does give you a boost. But if it doesn't matter if you can't, no one thinks any less of you. I
think that's definitely good advice. What advice would you give to friends or distant relatives of other patients watching this who they're not sure what to do now? Then should I visit? Should I stay away? Should I ask how the person's getting on?
I think feel free to ask. I think it's definitely nice to hear from people, and people that you haven't heard from in a long, long time, but have found out that you're poorly and want to know how you're getting on. It's lovely to hear that people care, and people that you didn't expect to hear from as well. And just keep in touch. Text messages are great, emails great if you're that way inclined, because people can pick up as and when they feel able to and respond. Phone calls can be hard because they're very emotional, and also you don't have a lot of energy to make long phone calls, but short visits when you're up to it are excellent, really nice. But if, say, work colleagues are coming, there's nothing worse than sort of 10 people bumbling through the door, you know, 1 or 2 at a time, and certainly on the hospital ward. But on the hospital ward, they encourage visitors. The cancer wards in Leicester are extremely open to visiting. They have a day room and also around the beds. They're very, very welcoming places. Although I understand it can be shocking, because you focus on your friend, other people are ill around them as well. But definitely keep in touch with people, let them know what's going on, so that they feel like life isn't passing them by. They're a part of life still.
Mm. Did you come across any specific resources that were helpful, either through the hospital or outside, or maybe support groups or internet?
I certainly use the internet a lot. The Lymphoma Association were particularly helpful with very clear and concise information about my cancer and my diagnosis. I personally didn't use chat rooms, but I know people that did use online chat rooms and befriending schemes. I think because my sister had been through it as well, I'd got quite a good understanding of the actual cancer. I accessed a charity called Look Good Feel Better, which, when you're feeling at a good stage, is something for women run by the beauty industry and the pharmaceutical industry to provide makeup and beauty advice, and you get a really good goodie bag of products, and staff from the beauty concessions in department stores volunteer their time to spend with you and show you how to make the most of things, how to draw on your eyebrows if you need to, and you know, how to look good at a time when, you know, you really, you know, need to put your best face on at times.
Let me ask you about the future now. Really, you've been through a lot, and your family too, your husband. Do you feel secure in yourself again? You know, when you've had a condition which is uncertain and you've had a relapse as well, sometimes it's hard to regain your confidence, you said, the word confidence, about how you feel today and where you're going in the future.
Day to day and month to month, I feel confident, I feel good, and I feel well. And my husband is also in a good place. I'm doing more, I'm getting involved in things, and I'm busy living. We are planning for Christmas, so that's sort of 3 months ahead. We're also planning to do things in the next 6 months. I wouldn't say I'm thinking too much further ahead than that, and it's not a negative thought. It's simply that I don't want things to be taken away from me. I had to cancel our dream holiday due to my illness because I spent so long planning it. So now what I'd rather do is say, right, in 2 months' time, we're going to book and go away and do it more spur of the moment. It's in my mind that we'll do it. Yes, we're definitely moving forward, we're making plans, and we're taking every opportunity that we can, you know, but being sensible at the same time, because my energy levels are still rebuilding, and I've still got quite a long road to go, and always will have.
Would you say that you're different as a person now compared to how you were before that diagnosis of non-Hodgkin's lymphoma came along?
I don't think my work colleagues would tell you I'm a different person. I think they'd tell you I'm the same sort of sarcastic and pessimistic person I've always been. I am a different person in the sense that I take more risks and challenges in my social life. I'd reached a bit of a rut socially, and I needed to actively go out and make some more friends because everybody's lives move on and families start to appear, and so I actively joined the Women's Institute in my local village and have joined the committee, and I actively became a school governor because both of those things appealed to me and played to my strengths, but are also challenging me. I went to a WI meeting last night where I swore blind I wouldn't come away as treasurer, and somehow I've come away as the treasurer. So Yes, I'm challenging myself, but in a controlled way. I now know that you know, to do that, I need to sort of let a couple of other things fall by the wayside.
Would you ever go so far as to say that having that diagnosis can be almost a positive, if only to reprioritise what's important to you?
I don't think I could ever say that hearing the news that you've got cancer is a positive thing, but coming through treatment gave me the impetus to make changes in my life for the better, changes which I needed to make prior to treatment. My friends and my new friends have welcomed those changes in my life and helped me to make them, based on the fact that time is precious and sometimes you waste time without knowing that that's what you're doing.
Well, Heather, you've covered a lot of ground on the video, and I'd like to thank you on behalf of myself and the viewers for taking the trouble to tell us that whole journey, and I very much wish you all the best for the future and hope that things go well for you from this point onwards.
Thank you very much.